I just lived a normal life for 20 years before this, and there was a tumor in my head all the time.
Welcome to the Strokecast. A Generation X stroke survivor explores rehab, recovery, the frontiers of neuroscience, and how to peel a banana with one hand.
Hello, I'm Bill Monroe, and welcome to episode 118 of the Strokecast. This episode is coming out right at the beginning of 2021, so Happy New Year, everyone. We made it. Whew. It's been, well, I'm just grateful to get past 2020 and really excited for what's going to be coming up in 2021. Some things I already have planned, some things I am just sort of theoretically hoping for, and some other things that I'm sure are going to be a wonderful surprise. Over the past few weeks, it has been awesome to see some of my amazing care team members from my hospital time getting their COVID-19 vaccines to help keep themselves, their families, and their patients safe. I look forward to doing the same when it's my turn, which I have no idea when that's going to be, maybe sometime this spring, whenever my proverbial number comes up in a good way. Anyway, today's guest is Ruth Carroll. Ruth joins us from the Republic of Ireland, where I think she may have actually stayed in every hospital in the city of Dublin. Ironically, one of the things about this conversation that really jumped out at me is just how calming it is to listen to Ruth talk. I mean, her accent is a part of that, and it is lovely, sure, but there's also something just very comforting in her demeanor, whether she's talking about the more horrifying aspects of her journey or something as pleasant as the benefits of hydrotherapy. So let me share that with you. Let's go ahead and meet Ruth. Ruth, thanks so much for joining us on the show this week for our second attempt to make this happen.
No problem. Thanks, Bill.
I always like to think that if I'm not occasionally screwing things up or making mistakes or falling, it just means I'm not trying hard enough.
That's it.
So, and actually that sort of mirrors what one of my physical therapists once said to me, and that's that if you don't have one of your patients fall at least once a year, you're probably not pushing your patients hard enough.
Yeah, well, my physios definitely pushed me hard enough, so I had a few falls.
I mean, your stroke story, it really starts with your pregnancy. So,
yes.
I mean, what was your life like before you began building your son?
Before I was even pregnant, I was working hard in a stressful and a fast-paced job. I was a brand manager in a marketing team for McDonalds for 7, maybe 8 years. So it was busy, it was long hours. It was a lot of deadlines. It was go, 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 go to work, go to the gym, home, dinner. So it was busy, but it was good. I was healthy. I walked a lot. I did go to the gym quite often, so life was good. I was living with, I suppose, my fiance at the time. Oh, we were newly married. So yeah, that was my life in a nutshell. Yeah, and then of course we got pregnant, which was amazing. It was just such an exciting time for us. So yeah, that was really good. And I had a fantastic pregnancy. The first 9 months were brilliant. No medical issues. I felt great. I was loving every second of it until the 9th month.
Even when you just say that, I was loving every minute of it, I still just hear, now with McDonald's in my head, the I'm loving it just popping up into the background.
Exactly. There you go. I meant to make that connection.
So things were going well. You're maintaining a healthy lifestyle despite the temptations of the cheeseburgers and Big Macs. And French fries, and I could just go on and on like that. I
did eat a lot of them, to be fair.
So you were maintaining your health, and so this came as a big surprise. You're 9 months into your pregnancy. You're just about getting ready to give birth, and then you got the big diagnosis. What happened there?
Yeah, so I just noticed in my 9 months that the pupil in my right eye was quite dilated compared to my left eye. So that obviously concerned me a bit. So I simply went to Specsavers and just asked the lady there to have a look. And straight away she told me to get into A&E because she saw something behind my right eye. She basically said, look, I don't know what it is. She said, I see a shadow of some sort. So obviously that was a bit scary to hear. So I went straight into A&E and they gave me an MRI scan. And that's when the next morning after the scan, they diagnosed me with having a brain tumor. It was a grade 1 meningioma brain tumor, which luckily wasn't cancerous, but very scary to hear when I was planning to give birth within the next couple of days. So the main priority, obviously, as soon as the diagnosis came through, was to get the baby out. So the C-section was scheduled, I think, for about 8 or 9 days after we found out I had a brain tumor. So it all happened really, really fast. Quite a scary time, obviously.
Yeah, absolutely. And how big was that tumor?
My neurosurgeon told me it was the size of an avocado pip.
Wow.
So yeah, it was big enough, really. I asked him, before surgery, I said, will you keep the tumor for me and put it in a jar? I was interested in seeing it, but he said no.
But do they know what caused that tumor?
I asked that question and he basically said to me it was just my genes. Nothing caused it. What he said to me, actually, he said, Ruth, the amount of people who are walking around in this world with a brain tumor in their head and they've no idea, they've no side effects. And supposedly I had that tumor for between 15 and 20 years and I never had a symptom. I luckily never suffered from migraines or headaches. I just lived a normal life for 20 years before this. And there was a tumor in my head all the time. So what happened was when I was pregnant, obviously the pregnancy hormones are there to grow whatever's in the body, obviously the child in this case. So it also made the decision to grow the tumor that was sitting up in my head. So that's what caused the tumor to grow quite quickly and quite suddenly, around my 9th month of pregnancy.
And even though that doesn't turn out to be cancerous, just having that there, I mean, you've suddenly got this thing growing to avocado pit size and likely to continue growing, and there's not a whole lot of room in there for stuff to grow into.
No, and unfortunately for me, the type of brain tumor it was, the grade 1 meningioma, actually isn't a very dangerous tumor. My neurosurgeon, Dr. McNally, said to me, he said, if I had to choose to have a brain tumor, that's the tumor that I would choose. But in my case, what was very dangerous was the location of the tumor, because it was very tightly wrapped around the internal carotid artery, which is obviously a very important artery that covers or that carries blood to the brain. So it was the fact that it was located near that and actually wrapped tightly around it. That's what made my situation quite unique and quite dangerous when it came to removing the tumor. I had my son on the 31st of March, and thankfully he was a perfectly healthy boy, not affected or impacted in any way by the tumor. So the day after he was born, I was back in the hospital visiting him, and the tumor had grown so quickly and to such a large size that it actually stopped the blood supply going to my brain and hence caused me to have an ischemic stroke, which paralyzed the left side of my body.
I mean, it's so fortunate that it held off until that point, and then that if you're going to have a stroke happen, to have it happen while you're already at the hospital, that's
absolutely
the best thing. So I mean, what happened at that moment? What symptoms were you showing of the stroke? How did it manifest?
Yeah, I remember it well. Well, it's only about 3.5 years ago now. I was sitting on the hospital bed talking to my midwife at the time, and we were chatting away about Bobby. And they had brought Bobby in, so I got a good snuggle with him. I got to hold him in my left arm, which is nice to look back at photos of me holding him. Because little did I know it would be the last time I was holding him with my left arm independently. But I was sitting on the bed talking, and the next thing I noticed that my speech was completely and utterly slurred. It was a very strange and confusing time. I remember looking over my shoulder and going, who said that? And I could see the panic on my midwife's face. And straight away she said, Ruth, lift your arms. And I remember thinking, why? God, what's wrong with her? I thought she was the one who was having a stroke. But so I lifted both my arms. Well, I attempted to lift both my arms, and there was no problem with my right arm, but I couldn't lift my left arm. There was absolutely nothing I could do to get it to move. And so then she said, now lift both of your legs slightly. And the same thing, I couldn't move the left leg. So little did I know that she had secretly pressed an emergency button underneath the bed, thankfully. And I literally, within seconds of me realizing I wasn't able to move, the doors burst open and there was 3 medics came running in, straight on me, asking all those neuro questions that I'm sure you're familiar with as well, Bill. Yeah. What year is it, Ruth? Where are you? How are you feeling? Who's the president of Ireland? All these crazy questions thrown at you 100 miles an hour. So thankfully, those guys realized straight away what was happening to me. So I was brought into an ambulance because the hospital I was at was a maternity hospital. So they brought me to a hospital called St. James's here in Dublin, and they have a neurology team. They took care of me there, thankfully. So yeah, as you said, I was very lucky to be in a hospital setting, and that my midwife was very clued in. And, she went through those fast symptoms. She did notice that I had drooping of the face. Then she went through A for arms. She realized the speech had slurred, and then time, she pressed that button.
One of the interesting things there is that you had an ischemic stroke, not due to a clot, but due to the vessels being blocked from the outside, from the way the tumor basically closed them, pinched them off.
Exactly.
Obviously, the general treatment for ischemic stroke is to do a mechanical thrombectomy or to use clot busters like TPA, but none of that applies in your case.
No, the only option I had was to remove that tumor, because if it wasn't removed, there was a chance of another stroke striking. So luckily, we have a great hospital in Dublin that specializes in the brain, in neuro. It's called Beaumont Hospital. And I arrived there and I had a craniotomy scheduled for the 19th of April, 2017. And I mean, a craniotomy essentially is sawing open the skull and going right into the brain and unwrapping the tumor and removing it from the brain. It's all very graphic, really. So that's what happened. Luckily, I had a fantastic neurosurgeon and the surgery went very well. So at the minute, I just have what's my neurosurgeon describes as crumbs of a tumor left in my brain. So they need to be monitored very carefully. Every 6 months, I have an MRI scan just to make sure that those little crumbs don't grow in any way. I'll be monitored probably for the rest of my life.
Then it's off to recovery at the hospital. So what was your recovery and then your rehab experience like inpatient?
Yeah, so I went into a neuro ICU and I lived in there for 8 weeks. And all I remember about that stage was the pain after the brain surgery. I remember screaming at the nurses, asking for more pain medicine. It was an unusual time. I was having a lot of hallucinations. I was being pumped with a lot of drugs. I mean, the hallucinations are crazy. Ants were coming through the ceiling, surrounding the room, all crazy, scary stuff. Mm-hmm. So I was out of it really for those 8 weeks. Thankfully, really, I had no awareness of the severity of the situation. So after ICU, I was brought back to another hospital. I know pretty much every hospital in Dublin now. I've visited them all.
By my count, we're up to 4 now.
Yeah, we are pretty much. And there's another one thrown in there. But so I luckily got into our National Rehabilitation Hospital here in Dublin after a couple of weeks. And it's quite hard to get in there. There's a long waiting list. So thankfully I got that phone call and I went in there and I spent 3 months in there. And they were the ones who got me standing for the first time out of my wheelchair. And I took my first step in there. And my intensive treatment started, as you're probably aware: speech and language therapy, occupational therapy, physiotherapy, hydrotherapy. They were my main therapies that I was doing pretty much every single day, some twice a day. So it was a tough 3 months, but I was very driven and very motivated. I, unlike others, had, a big motivator at home, being a brand new born baby that I knew I had to get, I needed to get better for so I could go home and care for him. So that actually, even though it's a sad situation, it was a good motivator for me.
Was Bobby able to visit you in rehab?
He was, luckily. Luckily, I have a fantastic sister-in-law who happened to be on maternity leave. We were pregnant at the same time as soon as this happened. And what she did for me, which I'll be forever grateful for, she brought Bobby in to see me in every hospital that I was in, every single day, except for the day that I had my brain surgery. Every day. So Bobby was brought in to me and I got to snuggle him on the bed, which was an absolute huge thing for me. It was really important as well for our little bond. So yeah, to answer your question, during my rehab stay as well, he came in every evening and we had a nice little routine of, I had a tabletop on my lap, attached to my wheelchair where I used to place my left affected arm. So our little routine was we put a pillow up on top of the table. We'd sit Bobby on top of that. And my husband would push me around the rehab hospital. And, we'd go get a cup of tea and we'd say hi to all the other patients there. So it was a nice little tradition that we had every evening, something for me to really look forward to as well.
I know one of the highlights of my stay in rehab was each day just heading down to the coffee shop to just get a cup of coffee and then just sit outside in the car drop-off and just watch.
Completely. And just to get fresh air onto the face. It's the little things, isn't it?
It really is. It really is.
Yeah.
With those visits, or were you able to nurse Bobby at all?
When Bobby was born, I was able to breastfeed Bobby for about 5 seconds, and then they had to take him and, take him away, and they had to take me away because they very closely had to monitor my brain situation. So I was very passionate about breastfeeding. It's something that I really wanted to do, but because of the ICU situation and the medication that I was on, I wasn't able to. Something that really upset me at the time. Now, I'm fine about it. He's a perfectly healthy boy and, we just bottle fed him. So it was upsetting at the time, but it worked out really well.
Well, that's good. And it sounds like you certainly still have a great relationship with him today, and those visits, and you've really been able to make up for lost time with him.
Yeah, it's great because with the child, mommy just has an arm that doesn't work. He's just accepted that. He knows no different. Mommy has a funny walk. He's just aware of it and he just accepts it for what it is. So I often think if the stroke happened when Bobby was an older boy, like at this age, 3.5, I think it would have impacted him a lot more, So in one way, I was quite lucky that he was brand new and he had no other awareness.
Yeah, this was just normal for him.
Absolutely, yeah.
How is your rehab continuing now? Are you still a part of that, or has COVID shut all that down?
I'm quite lucky in that COVID hasn't shut it all down. It's shut down pieces of it. And like everyone else in the world, I have weekly Zoom calls with a lot of my therapists. But so since I came out of the rehab hospital, I have kept up the intensity of all of my therapies. So I go to physiotherapy, hydrotherapy every single week, and I have a great neuro-occupational therapist who comes to my house once every 2 or 3 weeks. So that was one thing when I came out of the rehab hospital. I told myself, right, I'm going to continue this intensity, because I knew, that a lot of people can plateau in terms of their recovery, and I didn't want that to happen. So I came home and I found therapists in the local area to continue up the hard work. And I've been very lucky in terms of finding the right people. I think that's so important as well. Obviously, it's very important to put in the hard work, but you need the right therapists, I find, to educate you on what needs to be done to push you in the right way. So I feel very lucky with all of the therapists that I'm currently working with.
It's, having the right team is just so important to the ongoing recovery. Mm-hmm. So I mean, we touched on the plateau a little bit there. I mean, there are a lot of folks out there who still believe you only have 6 months to a year. But I know more and more people I talk to find that that's not true. Of course, as you're more than 3 years out now, what improvements are you seeing over the past 6 months or so, this far out from the original stroke?
The main thing for me is my lower limb has really come on. Like you and I'd say every other stroke survivor out there, I went through the whole going into an AFO from the wheelchair and taking those very awkward robotic kind of steps. And then I had to use a cane to walk. But over the last number of months, I've started to walk independently, and my walk has got stronger and stronger. For example, I feel confident now going into a busy shopping centre and walking by myself. That was something there was no chance of me ever doing at the start. So the main progress that I'm seeing is in terms of my lower limb and my walk. In terms of my upper limb, my left arm and my left hand, I have got some movement back in the arm in terms of my shoulder and elbow in particular. I haven't got movement back into the fingers or the hand yet. So my fist is quite closed, tight. And I recently just got Botox actually into the fingers and the hand. So I'm hoping that will help in terms of the tightness in the grip. Mm-hmm. But so that's kind of the main area where I've seen progress. I'm lucky in that cognitively it didn't make much of an impact. Initially, it was very difficult for me to concentrate and to process information. But over time, that improved significantly. And I was also very lucky and thankful that I didn't lose my speech, which I know a lot of people unfortunately do. So it's strange to use the word lucky, but I do feel quite lucky in a lot of situations. So
one of the interesting themes I've seen is, as I talk to more and more stroke survivors, so many of us describe ourselves as lucky, and with the way the experience has turned out. Obviously, not everyone, but so many of us do.
Yeah, big time.
Yeah. I found the Botox to definitely help in my case with the tone and spasticity. And over the last 2 to 3 months or so, and I'm just about I'm about 3.5 years out as well. I've started to get back some individual movement on the fingers. So
fantastic.
Slow, but
that's
comes.
Great.
Yeah.
Mm-hmm. That's great to hear.
So one of the other things that it sounds like made a big difference for you was you had a great network of family and friends. I mean, how has your stroke impacted the relationships with the friends that you have?
Yeah, I am lucky. I feel very blessed that I have a fantastic family and I have a fantastic group of friends. I'm so lucky because I know a lot of people don't have that. In terms of my relationships, I see with my family, we were always very close before I had my brain injury, but the brain injury actually brought us so much closer together, which is a real positive and lovely outcome of such a terrible situation. In terms of my friendships, it's funny, I've been surprised a lot. A lot of people have surprised me in a good way. They have been so strong and been there for me. A few people have surprised me in a bad way in terms of not being there for me as much as I needed. So I've noticed that some people are strong and can handle the trauma of what happened to me. Some people have found it more difficult. So it's interesting to kind of step back and see how each individual has kind of reacted to my situation.
It really sort of highlights some of the priorities in our life and what we need from others and what we're able to give to others.
It does. And I think a lot of people, feel that, okay, this person is recovering for a year now, and I kind of feel that people expect after a year that you're fine and that you're back to yourself. And with me, in terms of my appearance, you can't tell that I've had a stroke. Luckily I don't have a drooping in the face anymore. You only know that something has happened to me when I'm moving. So a lot of people kind of feel, okay, Ruth is back to the old her. Whereas the reality is, as you probably know yourself, Bill, it takes a lot of years. And I feel even I need more support as the years go by in terms of just friendship and strong people there for me. And my main battle, and I'm not sure if I'm guessing you do suffer from this as well, as my experience is every other stroke survivor seems to. My biggest struggle, and it has been from day one when the stroke hit, is neurofatigue. And it's a difficult one because nobody can see it, and it's a battle every single day. It can really be crippling, and it has such an impact on everyday living. But it has improved for me because I've learned and I've educated myself on how to manage it a bit better. But it's always there. And I think, unfortunately, it will always be there for the rest of my life. But I'm the type of person, and I think it's an Irish thing, I put on a front. I'm fine. Everything's great, but I hide my neurofatigue very well. Which, if I had to do it all over again, I wouldn't. Because, it's unfair to others, really, for me to say, other people don't realize and understand the impact that fatigue has, when I hide it so well.
Right. And and I think that that's also an aspect of Irish American culture as well, in that putting up that strong front. And I think it's also, there's also, and I know this is very much in the American culture, is that there is a huge stigma on the idea of slowing down or taking a break or taking a nap. It's just instantly translated as lazy rather than necessary for recovery.
That's completely my experience, Bill. Before I got sick, I never, ever napped during the day. I mean, to me, it was just alien to get back into bed at during the day. But I now am very well educated about the importance of napping and switching the brain off for 40 minutes, to help manage with that fatigue. But at the start, initially, I had a huge guilt and shame around the fact that I had to nap. I tried to hide it from people. I'd be sneaking up to my room trying to get to sleep and then being unable to sleep due to the pressure I was putting on myself. But I've improved in terms of that. I tell people, because of my situation, I have to sleep. And when I sleep, I will have enough, fuel in the tank to last the rest of the day and to be able, to engage with people the way I want to. But I think, as you say, people aren't educated. And why would they be? Before I got sick, I wouldn't have known the importance of fatigue management like we do now.
Before we can educate them on neurofatigue, we have to first educate them on, yes, you can have a stroke before age 70.
Yes, exactly. That was news to me as well. When my doctor diagnosed the stroke, I remember being in bed thinking, this guy, it must be his first day at work. And I said it to him, I'm 33 years of age, not obese, very healthy. What are you talking about? To me, this guy was clueless. And the fact that he even said the word stroke was just completely insane to me. I was convinced that he was wrong. There was no way a 33-year-old, a healthy girl, could suffer a stroke. But yes, it's possible.
Absolutely.
And there's so many young people that I came across, and I'm sure you did too during the rehab journey, who are even younger than me.
Oh,
children as well.
Oh, sure. Absolutely. About 4,800 kids under the age of 18 have a stroke in the U.S. each year.
I believe, yeah.
And, a lot of people, when we start talking about it happening even with babies and infants, a lot of people know that cerebral palsy is a thing, but they don't know that half of all cerebral palsy is caused by an in utero or newborn stroke.
Yes, that's it. Yeah, I've heard a lot about, because of my situation, I've met other women, unfortunately, who suffered a stroke during labor. And I've also heard of stories, exactly as you say, of tiny babies being born while suffering a stroke. So, yeah, I mean, that's something I would never have been aware of before.
So yeah, living with the neurofatigue, and what I can say is that in my experience, it has gotten better. The thing that I found in my experience is that it really manifests as I don't have any buffer resources available. By that, I mean, as long as everything else is going okay, I'm fine. I don't have to deal with it. But if I have like a shoulder injury or something, or have to deal with a bunch of pain, that is going to suck all of my energy away.
Exactly. Yeah. It's so important to manage it. I have to kind of break my day up. I have to look ahead, and I have kind of a fatigue strategy in place. Like, I'll give you an example. Yesterday, I had hydrotherapy in the morning. I know that come the afternoon, there will not be energy left for anything else unless I get that 40-minute nap in between hydro and 2 p.m., for example. So it's just about managing and being clever and thinking ahead. And, yesterday, as an example, I did get my 40-minute nap, and I was able to have a nice, enjoyable evening with my husband and my son. If I didn't have that nap, poor Dave would come home to a wife that can barely, and it really can be as bad as, unable to hold my head up. Poor Dave has often had to come home to literally holding my head up because the energy isn't in my body to do it myself, and sometimes I'm unable to talk out loud. I literally have to whisper in his ear. It's the only thing that I can do. There just isn't the energy in me to vocalize or to project my voice. So it really, it's severe, but like you, Bill, it has improved, thankfully. I came across a video of me the other day back in 2017, and my God, I just look like I'm completely drunk off my head. I'm just falling over to the left, falling to the right, slurring my words. I was eating a bar at the time, and even the effort of lifting the bar up to my mouth, it was exhausting. And it brought me back to, oh my God, I forgot how really bad it was. So I think it's bad now, but the fact that I've seen improvements is really exciting and really positive.
One of the things I encourage new stroke survivors and or their caregivers and family members to do is, I know you don't want to think of yourself looking this way in the hospital and right after, but seriously, take a lot of pictures, take a lot of video, because a year from now, 2 years from now, you're going to see progress is slower and you won't think you're improving. But when you go back and you look at those pictures and look at those videos, you'll see the difference the time is made.
I completely agree. I wish I had taken more. And, you know, I've gotten into Instagram a bit lately, and this Throwback Thursday, I really enjoyed doing, because I'm literally going through my photo album from 2017, and I'm like, oh my God, yeah, I forgot about that. Look how bad I was then. And, you know, I like to do kind of a comparative video or photograph just to see the improvement. I find it so motivational.
So you've got these fatigue strategies in place. You've mentioned the hydrotherapy a couple of times. What do you do in hydrotherapy? What's that like?
It's my favorite therapy. I really enjoy it. So it's the heated pool. It's like you're stepping into a hot bath. So in that way, it's actually really relaxing, and that's the point of it. You know, it relaxes the muscles and it allows you to do more exercises and move the body in different ways in the water. You know, when I'm in the water in hydrotherapy, I work a lot on strengthening the lower limb. You know, I try to independently, obviously I'm not wearing my foot splint in the water, so I've tried to focus on walking up steps by myself with no foot support on and not holding onto a rail. Simple things like that. Balance is another area of work that I focus on in hydro. I forget myself how much balance was impacted as a result of the stroke. So simple things like standing on my own, not holding on to anything in the middle of the pool on my left affected leg. So making sure that I get weight down through the whole leg. The pool that I'm in has a treadmill on the base of the water. I simply walk on the treadmill in the water. It's easier in the water due to the buoyancy of the water, but at the same time, it's more challenging on the muscles and on the brain in terms of balance and focus and all of that. So I've seen some really good gains in hydrotherapy. You know, I was actually just talking to my husband about this the other night. When I firstly went to hydrotherapy, the only way that I could get into the pool was that electric chair, which I'm sure you've seen a few times, Bill. You know, sitting on a chair that's the go button is pressed and it slowly carries you down into the water. And after a couple of months, I got strong enough to walk backwards into the pool by myself. That sounds strange, but the rail was on the left-hand side, which obviously was no good to me because I couldn't, you know, hold on with my left hand. So if I walked backwards down, I could use my right hand. So that was kind of the next stage of my progress. And now today, I am able to walk down the steps forward, but I do have to hold on to my physio's arm just for extra support. And my near future goal, of course, is to walk myself down the steps independently. So I love that. I love stepping back and looking at that journey of the chair, walking backwards, walking forward. You know, as I said earlier, it just drives me.
That's great. Yeah, I like that. That way of seeing that path of growth. I mean, the great thing about being in the pool too is that if you trip and fall, you're not going to get hurt nearly as much as if you were in a gym or something like that.
Exactly. Yeah, that's so true.
So it can encourage you to do some what might otherwise be riskier things. When you talk about going backwards down the stairs, that's actually how in my early days, before I had a second handrail installed in my apartment at the time, that's how I got, that's how I had to go downstairs in my apartment, was actually to go backwards, just because I couldn't manage that twisted sidestep type of thing. They tried to teach me
exactly. And then you had people looking at you strangely. I was the same. My hairdresser in Dublin here is up a load of stairs and they're kind of windy, like you said there. So the only way I could get down initially was to walk backwards. And I could see people looking at me as if I was off my head. And I remember one man coming up to me, "Are you okay, love? You're walking the wrong way now. Are you okay?" I was like, "Oh, how long have you got? It's fine. You know, thanks." But, you know, it's kind of funny looking back now, I suppose.
Right. No, it's okay. I just broke my brain.
Yeah, exactly. That's it. That's a good way to describe it, because a lot of people say to me, "Oh, did you have a hip replacement or did you hurt your leg?" Yeah, I'm going to use that. I just broke my brain.
Yeah. Well, that's the thing about all of this is that I know my problems are literally all in my head. There is absolutely nothing wrong with my arm or my hand or
Yeah,
my leg. It is literally all in my head.
exactly. It's all about making that connection from the brain to the limb. Nothing else, as you say, which is interesting, isn't it? Because, yeah, initially I was looking at my left arm and hand going, come on, what's wrong with you? You just start moving. But it's nothing to do with that limb, as you say. It's all about the brain. It's easy to forget that.
Yeah. Yeah, very much so. So while you've been working through your therapy, recovering, and you've got now your toddler running around, it sounds like your husband has been just a fantastic support system for you too.
Oh yeah, there really are not words to describe how good and how strong he has been during it all. And it was difficult on me, obviously, but it was hugely difficult on Dave as well. Walking out of the hospital by himself with a newborn baby and bringing him home, and he had never changed a nappy in his life, so it was scary and it was very daunting for him. But he managed. He was able to balance trying to keep a newborn baby alive and being with me in the hospital, coming to my physiotherapy sessions. So it was difficult, but man, did he do a good job. He's great. I'm very lucky.
That's awesome. And what is the stroke support community of survivors been like in Ireland or in Dublin?
Yeah, we're lucky actually in Ireland. I've noticed there's a lot of services out there for people with brain injury. Just to give you an example of some of them, Headway is a fantastic company, organization for anyone in Ireland with a brain injury. There's Acquired Brain Injury Ireland. There's Brain Tumor Ireland. So there's a lot of these fantastic places, and they're just there as a support. They're there to educate, and they're there just to be there for you. So I have found them very, very useful in terms of mental health support as well. Headway in particular has been great, because going back to being typically Irish, I was like, sure, I'm grand. I'll focus on my physical recovery. But, I now see that taking care of the mental health side of things after such a trauma is very important. So I do have a girl in Headway who I go to every week just to sit down and talk about my feelings, talk about how I'm dealing with things. And I can see why people go and talk to someone in counselling now. Initially, I couldn't understand it and I thought it was a bit of a waste of time, but it's been very helpful and very important in my recovery.
It's fantastic. There is that support in place there. And that brings us to our hack of the week.
Yeah. One tip I have, and I'm stealing it from a nurse in the rehab hospital. And I bet you feel this as well, Bill, the simple task of having a shower every day was so difficult. People have no idea the energy, firstly, that it takes to stand, to manage your balance, and to try to operate your shampoo bottle, your shower gel bottle with one hand whilst, managing your balance. Difficult, and I used to dread having a shower every day. So one tip that a nurse gave me, and I was like, oh, this is genius. She simply said, make sure you have a pump on each of your bottles, and you wouldn't believe the difference it made. So I do not buy shampoo, shower gel, or whatever it is anymore without having a pump on the top. It sounds so small, but it makes such a big difference to everyday life. So that is my little hack of the day.
If folks want to know more about you and what you're up to, where should they go?
I've recently only got Instagram, as I mentioned earlier. So I'll tell you the name of my account. I struggled with this the last time with you too. It's Ruthie_Carroll 84. So that's where people can go. I've looked at Instagram in terms of my brain injury. I feel I just have so much to share. I've been very lucky to have the amount of treatment that I am getting. So I use it as a platform to kind of share with fellow stroke survivors and with, normal people, as I call them, who have a normal operating brain. And I have found Instagram so good in terms of connecting with fellow stroke survivors and learning so much from other people. So yeah, that's where you can go to find me.
Awesome. That is Ruthie_Carroll 84. And I will have those links over in the show notes over at strokecast.com as well. So you can just follow those
great.
and check that out.
Mm-hmm.
So Ruth, this has been an absolute delight, and I could just listen to your accent for hours.
Thanks, Bill.
And thank you so much for your for joining us as we made this second
Thanks for having
successful attempt.
Absolutely, we did it.
A couple episodes back, Kristen Aguirre mentioned getting pumps on your shampoo bottles as well. So there's a lot of advantage to going ahead and doing that. If your preferred shampoo, conditioner, body scrub, body soap, serum, whatever, doesn't really come with a pump option, you can go ahead and find generic pumps for most bottles online, and you can just add them to whatever bottles you already have. I actually linked to some of those over in the Strokecast gift guide at strokecast.com/gift guide. There is a lot of really fascinating stuff in Ruth's story. I mean, for one thing, it's the first ischemic stroke story I've heard about that did not involve a clot or a failure of the wall of a blood vessel. I mean, it really further emphasizes just how important it is to recognize the signs of stroke regardless of age or physical health. So everyone should become aware of be fast. They should know to be fast to recognize the signs of stroke. Be fast, of course, is the classic stroke symptoms that we need to be looking for. B for balance, sudden loss or change in balance. E for eyesight, reflecting a sudden loss or change in vision. F is for facial drooping. Sudden facial drooping could indicate a stroke. A is for the inability to hold both arms out. S is for slurring of speech or sudden loss of language. And T, of course, is time to call the ambulance. So be fast, balance, eyes, face, arms, speech, time to call the ambulance. If you see those signs, recognize that it might be a stroke and you should call the ambulance, and make sure everybody knows to look for those signs too, because you never know when a stroke is going to strike, and that's why you always have to be observant of that. And of course, we know that the faster you get to the hospital, the faster the treatment can begin, the more likely it is that they can prevent many of the disabilities that follow us for months or years to come. Ruth's discussion on hydrotherapy is also great. Hydrotherapy itself is a really fascinating space. It's different from just going to a swimming pool. For one thing, the water in a hydrotherapy pool is a lot warmer. And this matters because, it helps the muscles loosen up for the exercise. And we're not just talking about the loosening up or stretching that an athlete might do before a race. It's really about helping to reduce the tone and spasticity that can interfere with getting that hydrotherapy workout. Because in the cold water, just like in the cold weather, we typically see that tone or spasticity will go ahead and increase. So a hydrotherapy pool is going to be at a much higher temperature to help prevent that from being an issue. On top of that, a hydrotherapy pool is also more likely to have the adaptive equipment available that is needed to help folks with disabilities get safely in and out of the pool. And finally, a skilled therapist can really help you perform the exercises aggressively and safely so that you can get the most out of your experience. It gets you that much further along to getting the thousands of repetitions that we talked about with Peter Levine from Stronger After Stroke a couple of episodes back. If hydrotherapy sounds interesting to you, go ahead and ask a doctor or a therapist in your area for a referral to a specialist or organization that actually offers hydrotherapy for neuropatients. Or, of course, you can always reach out to Ruth through Instagram to learn more about her experience. It was also really heartening to hear about the extensive support Ruth has found in the brain injury community in Ireland. You can find links to those groups that she mentioned in the show notes over at strokecast.com/Ruth. So be sure to visit strokecast.com/Ruth for those links and for links to Ruth's Instagram so you can continue to follow her journey. Visit strokecast.com/gift guide for links to bottle pumps, books, and other gadgets to make life a little bit easier. Mask up and stay safe in 2021. And of course, as always, don't get best, get better. Thanks a lot. I'm Bill Monroe, and I'll talk to you soon.
The Strokecast, Bill Monroe, and Bill's guests provide general information and entertainment, not medical advice. Please do not make any changes to your treatment plan or the execution of your treatment plan without first consulting your personal doctor or medical team. The Strokecast is a proud production of the Currently Speaking Podcast Network.